Welcome to this episode of Surf Sessions. Today we have Geraldine Bliss with us, the founder and president of CureSHANK. Geraldine, thanks for joining us.
We're just happy to be here.
Yeah, we're really excited to have you. You're our second nonprofit leader on the series, and we know that board management is difficult for everyone, but nonprofits, I think, just have a different set of needs and unique situations that can be difficult to navigate from board engagement or just, having a very new organization that you're building from the ground up for the first time. I think a lot of nonprofit leaders struggle to kind of find their footing with board management. So we're really excited to pick your brain today. But before we get into all of that, I want to give you the chance to just tell us a little bit about CureSHANK and what you do.
Right. Well, we launched CureSHANK in 2019. We received our 501(c)(3) in March of 2020, the end of March, right after the pandemic had started. It was a rough way to start. We had originally planned to have some fundraisers in Houston, where I lived at the time, and Los Angeles, where one of my co-founders lives. And all of that got derailed by the pandemic. So we had to back up and kind of start over, but it really turned out to work out well. We used those first couple of years just to do landscape analysis and talk with our stakeholders and really develop a good strategic plan for CureSHANK. So I should back up and tell you a little bit about myself and about what CureSHANK is. Um, I have a 26-year-old son, Charles, who has Phelan-McDermid syndrome. It's a very rare genetic condition. It's caused by the loss of a gene called SHANK3. And that gene is really important in the synapses. It helps to sort of create the structure of synapses. And if it's missing, then a lot of things happen in the brain. Most people who have this syndrome, which is called Phelan-McDermid syndrome, have intellectual disability, usually on the more severe end, autism, and sometimes epilepsy. And my son is one who has really severe epilepsy. He has a form of epilepsy called Lennox-Gastaut syndrome, and that just means that he has seizures every single day. He has many different kinds of seizures, and they've been unresponsive to treatment. So that is actually what got me involved in research advocacy. I became involved when he was younger. He was probably about 9 years old, and his seizures had started about a year prior, and we were having a very difficult time getting seizure control. And I remember being in the hospital and complaining to his doctors, we know what this gene is, we know what it does in the brain. Why can't we have targeted treatments for his condition? And their response was, it's just a little bit too early. I thought, we need to fix this. We can't, it's not right for little children to suffer so much. And so I approached the patient advocacy, the patient support group, and I said, let's put together, strategic plan for research, and let's put together a committee. And we did, and did that for several years. And then another board member and I decided we really wanted to do something that would be very, very focused on drug development, and kind of taking some of that good basic and translational science that had been done and helping move it to industry where companies could develop treatments. And so that's what we did in 2019. Today, Charles, he's next week or this weekend, he'll be turning 26. He still has seizures every day. And so we're still, here it is many years later, and we're still working really hard. But we have some good things that are happening right now. We have a gene therapy that has just recently received permission from the FDA to proceed with a clinical trial. And that should happen later this year. That's really exciting. It will put the SHANK3, a miniature version of the SHANK3 gene, back into people's brains. And then we also have a drug that's been in clinical trial that looks really, really promising from their kind of their first data set. So we're hopeful that will proceed with what's called a registration trial. And if all goes well, the FDA will sort of give it approval for use in Phelan-McDermid syndrome. And then we have several other companies that are working on different kinds of treatments. Sadly, in rare disease, there's a huge challenge with getting drugs like all the way past the finish line. A lot of drugs fail either early on or they fail in the clinical trial process. And so even though we have two really wonderful ideas that are kind of proceeding through the normal channels, um, the the odds of any one drug getting approved are pretty slim. And so we need a lot of shots on goal. And that's what CureSHANK is doing. We're really trying to work with academic scientists and companies to make sure that we do have all of those shots on goal that we need to ultimately have treatments for Phelan-McDermid syndrome.
Yeah, I mean it's amazing to hear how much you've grown in such a relatively short period of time, really just starting out 5 years ago, and getting to this point now. And I definitely want to talk about kind of that entire journey from starting out to, scaling. And I'm sure there were so many learning curves along the way. So we'll definitely dig into that, but it's really exciting to hear about everything that you have, going, and it sounds like you've been making some really amazing progress. I also definitely want to touch on this idea. I think a lot of nonprofits, especially in the rare disease space, have, scientific advisors, like you mentioned. You're working with, multiple different types of advisory boards in addition to maybe your primary board, and managing all of those different stakeholders, I think, is a unique challenge. Um, but before we get into that, just taking a step back, I'd love to hear a little bit about kind of the early days of building your organization and kind of getting your board up and running for the first time. Did you have a clear vision of what you wanted for your board? Was that something you really did, you figured out as you went? What did that look like?
So our board actually hasn't changed very much since we founded, although this year we anticipate growing our board. So when we launched, it was me and Abby, my co-founder in California, and Paulina, my other co-founder in Chicago, and they also are parents of children with Phelan-McDermid syndrome. And in a lot of ways, having a small board allowed us to be really nimble, right? And we developed a wonderful scientific and strategic and scientific advisory committee that advised us on like projects we should invest in or next steps. And having a small board allowed us to really move quickly. But now, as we're growing, we're really contemplating adding more board members. And part of it is driven by just kind of the number of projects we have going on, our need for increasing our fundraising, increasing our communications. So we need to grow. And so that's one of the things that we'll be doing later this year. Um, but I would say one thing that's kind of unique about our board, we have since added one other mom, and her name is Talia, and she lives in Houston, and she is also a parent, and she's an amazing communicator. And that was one of the areas where we needed some help. And she's really been just incredible, just such a wonderful asset to CureSHANK. But I think what's unique about CureSHANK is that we're, an all parent board, and we have this incredible passion, right? It's not just that we're doing this because we're sort of interested. We're doing it because our kids' lives depend on, new treatments that are going to be coming. And we never, for better or worse, we never take a rest. Like we're always working on this because we have so much at stake personally. So that's kind of when I wouldn't necessarily say it's a healthy thing all the time, but it is kind of what has brought us to this point so far. It's just that personal passion.
Yeah, and I think that's not, that's a story we hear often in this space. And I'm sure it's a very powerful motivator. But yeah, also, I'm sure there are days where it's exhausting. And it is a nonstop thing. I'm wondering, as you're thinking about growing this next year, if you have any clear plans for that. Are there specific, you mentioned, your newest board member was someone you recruited because they had that really great communication experience. Are there other areas or skill sets that you're really looking to fill? Or do you have kind of a different strategy for how you want to build your board?
Well, yeah, we have some thoughts. We think that, internally within our patient community, we need to keep kind of expanding our communications. And so very likely we'll add one or two more parents to our board. And then we also know for fundraising purposes, we probably need, in rare disease, you're limited by the size of your patient community, right? That's a very defined kind of finite number that grows slowly over time. And so if you rely on your patient stakeholders as your primary source of fundraising, you're really limited in your ability to raise a lot of money. And so what we'd like to do is start including growing our board with people who have like communities outside of like our immediate disease community. In other words, that can kind of broaden our reach in terms of our fundraising capacity. So we have a few people in mind and we'll start reaching out to them pretty soon.
Yeah, that's great. I'm just always curious to hear, some people really are just going after a specific skill set. Some people want, that personal connection. There's a lot of different ways to build a board. So I just always am curious about kind of how people go about that. It's interesting, I think you have kind of a unique board setup in some ways where your board is also, you have board members who are really actively working with your organization. They're not as maybe removed as is the case sometimes. I'm curious to know what it looks like the way you typically work with your board. Are you, communicating a lot outside of meetings? Are you really talking every day? What does that look like for you?
Well, yeah. So in addition to the four of us being serving on the board, we also have kind of leadership roles within the organization. So I'm sort of the de facto CEO, and Abby's sort of the de facto COO, and Natalia's our, chief of communications. So we have these roles as well. And because of those roles, we're constantly communicating every day. And we found ourselves just even late at night texting, emailing. It was a lot. And so one of the reasons we really liked Surfboard was that ability to like kind of move some of that conversation so that we're not constantly, for me anyways, I'm not constantly having to attend to my emails or my text messages, but I can check in on Surfboard. So we do use Surfboard not just for sort of board management kind of things, but communication within our executive team. And then the other kind of, as I mentioned, we have a strategic and scientific advisory board. And as we become more familiar with Surfboard and really become more competent in using it and familiar and just capable with it, then I kind of envision setting up our advisors within Surfboard as well, so that we can kind of have more for, I think it will make it a little bit more seamless for me since I'm sort of interfacing with all the different parts of the organization.
Yeah, definitely. Juggling all of those different communication threads can be so overwhelming. Like, where was that? Was it in a text? Was it in an email? Um,
That's one of our big challenges, and it was really kind of slowing me down. I'm like, I know we talked about this, but where was it? So I think knowing I can kind of turn back to Surfboard, and we've kind of tried to organize our conversations there. So I think I'm doing better now.
Yep, I mean, that is a challenge for, I think, everyone we talk to. I would love to know, it's great to know that Surfboard has been useful to you already. I'd love to know if there are any specific tools that you've found particularly useful or your team is using more than others.
My guess is that we're probably using I think it's called private chats or
The messages.
just where we set up a lot of conversations. And so we've kind of, I would say for each of our strategic goals, we have like a, I don't know what it's called, like a thread. And we can put any content related to that strategic goal in that conversation. Um, and that kind of allows me to kind of just quickly, like, where are we on certain project on different goals that we have. And then sometimes we have a special, like a project that's just a standalone project, and we set up a conversation for that, and I can kind of monitor, or we can all stay abreast through that. So for us, that has probably been the most helpful feature, I guess, just as a means of communication. I think we've done a couple of board meetings now on Surfboard. Still kind of learning how to run a board meeting on Surfboard. We only meet for official board meetings once quarterly. So, and we've only been using Surfboard for for a few months. So that's a feature that we're still, learning how to use. But hopefully we'll move more of our meetings to Surfboard.
I would love to hear a little bit about kind of what your board meetings look like with or without Surfboard. I think board meetings are something that typically can be high stress for a lot of organizations. It's one of the few touch points they have with their board. Your, again, situation is a little bit different where you're working with your board really closely day to day. I'm curious to know kind of what your board meetings look like and how you use that time.
Yeah, so we usually try to put together an agenda beforehand so we know what topics we want to focus on. Since we are in communication quite frequently, we typically don't have to hash through a lot of details. We can kind of just like highlight sort of the major updates on major programs and then kind of quickly get to our voting. And we have been trying to use the voting feature on Surfboard as well, which is really nice to have a record of that.
Yeah, and I think you're just in such an interesting position where, founders who aren't working as closely with their boards day to day, there's a level of formality there where there's a little bit more of that reporting structure. There tends to be a little bit more rigidity around what those relationships look like. But your situation is so different, where your board members are also your management team. They're people that you're talking to every single day, all the time, which I imagine is really beneficial. Like you're not having to kind of jump through those hoops of worrying about what your board members think, or we hear a lot that board meetings can just be really stressful because people aren't used to talking to these people as often. And that isn't the case for you.
It's very different for us, I think, because we're facing such similar challenges that are sort of unique in the world. Like in Phelan-McDermid syndrome, there can be really severe behavioral issues, right? Really severe neuropsychiatric illness that occurs in adolescence. And because we're sharing these really similar and terrible experiences, we don't have a lot of disagreement. Like a lot of times our personal conversations bleed over into our work. It's really horrible that, my kid has tried all these medications and nothing has worked. Okay, guess what? That's a research topic, So we tend not to have a lot of disagreement about like what CureSHANK should be doing or what deserves CureSHANK's funding. It hasn't been stressful. So we're in some ways kind of that's a little bit different about our organization. It's
Yeah,
probably true in many rare diseases, honestly. I mean, many of these kind of rare neurodevelopmental disorders or challenges are really, really difficult. And my guess is that most of the kind of the like founders and small boards, like for rare disease groups, have a similar experience. I think you're coming from that place of sort of shared experiences and even shared values. If you're part of a board that's trying to cure a disease, you're all on board with, this is the direction we're trying to go. So, yeah.
yeah. I would assume one conversation we have often with people in the nonprofit space is sort of issues around board engagement, just having your board, be really tuned in, reading materials, participating more proactively. I'm assuming that's also not an issue for you.
It's really not. I mean, we do, like I said, we do a lot of communication outside of board meetings. We meet once a week, just to kind of touch base, update, the weekly update. And since we all happen to be board members, that really makes it very streamlined when it comes to our board meetings. So I would say that frequent communication it makes it easier in many ways to manage the board meetings.
Yeah, I think it's so interesting because this is advice we give often. Like you should be in more frequent communication with your board. We also give the advice that it can be really beneficial to recruit board members who have a personal passion or tie to what you're doing. And it's almost like you're sort of modeling that inadvertently just because of what you're doing and the nature of, you know, what you're trying to accomplish as people who have such a personal tie to this. I think it's great. Like you're kind of the role model.
Well, we're going to have to adapt a little bit as we grow our board and add board members that maybe aren't parents of children with Phelan-McDermid syndrome. We're going to have to rethink how we're communicating, and we're going to have to figure out like what we don't want to overwhelm them with all of the things that we're doing every moment of every day, right? So we'll have to rethink how we're some of our operating procedures, and we'll need to probably pare back a little bit on some of that communication. So yeah, we're gonna have a challenge kind of going the other way now pretty soon.
Yeah, a little bit of that growing pain of, yeah, scaling a little bit. Sort of in that vein, I don't want to paint too rosy of a picture of, I do think your board in some ways is a great role model, but I'm curious to know if there have been any challenges you've encountered in the last 5 years, whether that's, how you're communicating or any sort of process that, maybe you realized, oh, this isn't quite working and there's a different way we should be doing it. Have there been those moments for you?
Um, yeah, I mean, I think some of the decisions that we've made this year, one, to grow our board, I mean, that really comes from a place of really needing to increase our capacity as an organization, particularly with fundraising and with communication. And I know with four people that essentially kind of are the executive leadership team and the board itself, we're limited in what we can do. And that really is kind of for us, we really are at a point where we need to grow pretty quickly. So, um, yeah. Otherwise, I would say not so much in terms of the board. There's certainly things that we're learning all the time in terms of our operations as an organization and in sort of the projects that we take on and just I think for us, and I guess again, this is kind of where we're different, but because this is like we're all passionate about this, there's I think that tendency to lean in like a little bit too much sometimes, right? And it means it's exhausting, and we're trying to care for kids with extreme needs and run a nonprofit, and then at some point we have to kind of take care of ourselves as well. So it's I think we're all kind of we go through phases where we really feel that. We just finished a big symposium, and I think we're all like a little bit like just tired right now. And we need to gear up because in a couple of weeks we have another board meeting and we have a meeting with our advisors. So we kind of need to regroup and kind of pull it together again. But
Yeah, I'm sure it must be exhausting. And I think that's good reason to be really mindful about how you're working with your board and, even something that doesn't seem like that big of a deal, like managing different communication threads in text or email, maybe is actually, over time, it's like we don't have time, we don't have the energy to be tracking all these things down, mentally keeping track. Seems like there's a really good motivation there for keeping processes and communications really organized and streamlined.
absolutely, absolutely. Yeah.
Yeah.
I mean, it's important as we grow our board and um, yeah, so we've started kind of outsourcing a little bit of our work. We've hired a couple of people on a contract basis, and that's been a big step for us. Really important for us to be able to execute some of our programs. Um, and yet it also underscores the need for kind of improving our internal communications and really kind of keep streamlining things just for the efficiency of our organization.
Yeah, efficiency absolutely is a much more succinct way of saying what I just took 60 seconds to say. Yeah, I'm wondering if you have any like organizational strategies or processes that you've discovered that are particularly useful that other people might be able to apply for themselves.
I'm not exactly sure we're innovators in that area. We're always like trying to learn from other groups, like what they're doing and how we can be more efficient, more streamlined. So no, unfortunately, I don't think I really have any hot tips to share in that area. I will say, I mean, I do think that you know, like surfboard is a great for us was just kind of a great kind of a helpful tool for us. And I do think that's, we need to be looking for more of those kinds of things to make our work a little easier, streamline things, um, and just like maybe not have to work 80 hours a week, right? And take care of our kids and all of the other things. So,
Yeah, or have more time to take care of your kids because you're not, having to manually manage all of these other things that shouldn't require your time and energy. Yeah, absolutely. Well, this has been fantastic. We really appreciate you taking the time to sit down with us and let us pick your brain. I'm sure other nonprofit leaders, you said that you like to learn from other people, but what you're doing today is really helping other people also learn from you. So thank you. We really appreciate that. We want people to be able to have access to this kind of information and be able to model what other organizations are doing, so they don't have such a steep learning curve themselves. And we can really just sort of help everybody be a little bit more successful.
In the rare disease community, I will say we all kind of learn from each other. And I remember when I first got involved in research advocacy, reaching out to some other patient groups who had been around a little bit longer, and they were so generous in sharing their knowledge. Um, and now, I'm happy to do that for new patient advocacy groups that are forming. So I think that's one really wonderful thing. If you're going to have a terrible disease, have a rare disease, because I do feel like there's a lot of support within the rare disease community, and we really try to help each other out to the extent that we can.
Which is amazing. I think, yeah, the more we can all crowdsource that knowledge, the better. And I'm sure these are things that, you can't just type into Google and find a really convenient response.
No, no, yeah, a lot of these things are things that you kind of learn by fire and through experience, right? And we're always on this like learning journey. And this year, my eyes have been open to some things I didn't know. So this is science related, not not organization related. So yeah, we're always learning, and most of us are very small nonprofits. Our budgets are small, and we really can't afford to make financial mistakes. And sometimes, just sitting down and chatting with other groups about some of their programs, what worked, what didn't work, can just be incredibly valuable, just in so many ways. But ultimately, we all want to make the best use out of the gifts from our donors, right? We have a responsibility to use those in the wisest fashion. So there's a lot of kind of sharing, and it's all, I don't know, I'm very grateful for all the groups that have helped me, and I'm happy to help pay it forward now.
Yeah, and I'm sure you will. I'm sure someone out there is going to watch this and have an idea about how they can maybe do things a little differently. So thank you. We really appreciate it.